Let us examine the individual aspects of the different nail systems, or let's take a look at the external fixator systems. We'll start with the aspects of stability, weight strain, and mobility. It's all interconnected in a big way. All right, if we stick with the fit bone, then the same applies to both. We keep coming back to stability and the force for distraction. It's always a recurring theme. Due to miniaturization, we are very limited. It's very limited, the whole system. We need stability. We aim for full load bearing. That's already not the case for the fit bone. That's only partially the case for the Precise. The latest generation, the Precise 3, which has been around since 1.5, 1.75, or maybe it has been taken off the market for about 2 years now due to the problem of corrosion. A serious problem that we've also seen with the fit bone in the same way, which we have also seen with the Albizia. Consequences that immediately become apparent in the X-ray due to changes in the bone. The bone changes like an onion. The bone gets really inflated. It almost looks like a malignant tumor. On top of that, there's the pain, an extreme pain. There is redness as well. Then there's the swelling. Every doctor then says it's a serious infection. It's just process that occurs due to the decay products of iron. We just talked about that. The fluid enters the nail liner. In the end, after it has acted destructively on the inside, it comes out at this transition. From the thin rod to the intramedullary nail. It's the same with every intramedullary nail. It's always a telescopic principle. It comes out here. Nothing happens at the top. That's a static seal. This is where the action is. The decay products come out here and change the bone. There's nothing else to do but react immediately. It usually happens towards the end of the extension because that's when the rod is extended the furthest and the instability is at its greatest. And then there's nothing else to do but remove the intramedullary nail. The medullary cavity, it needs to be stabilized first so that the entire result of the extension doesn't collapse. Then in the end, it collapses. This is now a situation after an extension of maybe 8-9 cm. The patient does not want to lose even a millimeter under any circumstances. You need to attach external systems to keep that in place, to maintain the rotation, the correct one, so that there's no X, no O, no bending forward, no bending backward. This has to be ensured with the fixator. Next to the nail, it's not easy to attach in a stable form. Then the locking screws are removed and the nail is taken out. Then you go in with flushing mechanisms, similar to a Karcher high-pressure cleaner that's called jet lavage. They scrub and clean the medullary cavity intensively with many, many liters of fluid. That's not germ-laden, it's just corrosion, decay products of iron. And then they go in again with a drill and ream the inside of the medullary cavity by 0.5 to 1 millimeter to remove all this, to remove the altered material, and then you ultimately stabilize it with a solid intramedullary nail that you insert. So a massive part and stabilizing bone. And then this problem is largely resolved. Now, some representatives of this nail, or the nails that can show this corrosion, say, well, that's not so bad after all. We wait until the patient's wish is fulfilled, and then we quickly move on to a solid nail. First, we have the stability that is always lacking in this area. In the area of electromechanical and magnetic nails, we have never had comparable stability to mechanical nails, especially not comparable to the stability of a solid intramedullary nail. We advise the patients, no matter what happens, at the end of the lengthening, we take the nail out under maximum distraction. Very difficult to stabilize. Very difficult to ensure that nothing is lost for the patient, that the axes remain intact, especially the rotation. And then we insert this nail for additional costs. This transition involves a much larger surgical procedure than the initial operation. And this also comes with higher costs. Of course, you don't have to buy an expensive lengthening nail. You can stick with a cheap nail that is also used for lengthening, or for fracture stabilization. It's ideal for that, but the whole process of the surgery, in the case of corrosion, is a really big procedure if the patient is not supposed to suffer any disadvantages or only minimal disadvantages. Besides the strain from a second surgery, there are also financial burdens and so on.